gentlemen, ladies especially, be prepared to be amazed. Today's edition of W Talk, my name is Anil on the mic, and alongside with my producer Juliana, it's our pleasure to welcome you to today's special interview. Now, today's theme, as my producer has given me, strong women, stronger health, free breast cancer screening. And yeah, as the topic suggests, we are talking about something that affects many women in Malaysia, which is breast cancer, and also something that a lot of these women have been avoiding for some time as well, which is breast cancer screening. And when we talk about screening, essentially what is it that we are highlighting? We want women to have the courage. We want women to have the awareness, the early action for them to partake, so that, something can be done if they are susceptible towards, being diagnosed with breast cancer. But the most important question is, here's the thing, right? Many women still hesitate to go for a mammogram. Many women still hesitate to go and get themselves screened, or they even hesitate to speak about it when they feel something abnormal with their breasts. And that's why we've brought a special guest into our studios today. She's from the National Cancer Society Malaysia, a health promotion lead and medical officer, Dr. Livia Darshini Kanasan. Dr. Livia, good morning and welcome to TRAXX.
Hi, good morning, Anil. Thank you so much, first of all, to TRAXX for giving us this opportunity today.
Thank you. Thank you as well for coming over here and giving us an opportunity to use this platform and your voice and your expertise and to speak to the many millions of women and girls out there and educate them on the awareness. And we're going to break the stigma, Dr. Livia, today over the next 30 minutes.
Yes, definitely.
Before that, tell us a little bit more about yourself, Doctor.
Okay. My name is Dr. Livia Darshini. For short, you can call me Dr. Livia. So I'm the medical officer as well as health promotion lead at the National Cancer Society of Malaysia. Before this, I was a Manipal graduate. I did my husband in Hospital Sultan Ismail in JB, and my MO as a gynae doctor actually in Hospital Kajang previously.
Wow.
Before I have left KKM to join the National Cancer Society fully to pursue public health.
Right.
Yeah, so now I'm more focused into public health and advocating about cancer awareness across Malaysia.
Right. Yeah, public health. That's a very important element that we all need to focus on.
Yeah.
And, when you speak about public health, there are many facades, many layers in society today.
Yeah.
Some layers have got the resources and they've got the ability for them to get the necessary screening without needing to pay much. Maybe they can afford private healthcare and so on. And let's talk about the underserved community, Dr. Livia.
Of course.
Yeah, maybe you can share your thoughts and tell us, why is it so important that women from underserved communities to have conversations about breast cancer?
Okay, I think when it comes to the underserved community, one thing that they lack compared to the one that can afford it is basically money, right? So when we're talking about money, when we're talking about the cost of treatment nowadays, we're talking about the cost of any medical, not only treatment, screening, everything is a bit higher, obviously. So for those underserved community, this money is a very big deal for them. Right, so when they screen early and they detect early whatever illnesses they may have, cancer or not cancer, their cost is very much lesser. So that's, I think, one thing that they don't understand. So because by the time they go meet a doctor, today our focus is going to be on breast cancer, obviously. So let me just give that as a main example. So when a person who from an underserved community, they have symptoms, they feel a lump, or by the time actually they tend not to go see a doctor because they feel like, I have no money for this yet. Never mind, let me save some money first. I will, I have to sort this. My son needs to go here. My husband needs this. So never mind, let me save some money first. Then later on, I'll go see a doctor. By the time they finally meet a doctor, probably already got past lah. The mess has grown so big.
It snowballed into something bigger.
Yeah. So by the time they go see a doctor, it's very late. And of course, because it's so late, the cost of the treatment is going to be much higher, and their prognosis is going to be so much more poorer. Prognosis means their ability to get treated or to recover from their illness will be so much.
The difference between diagnosis and prognosis.
Yes, exactly.
Right.
Diagnosis means we find out, okay, you have cancer.
Right.
Prognosis is whether you will survive this cancer or not. How long does it take to treat you, and how well you can be treated and you can recover from this diagnosis. So that's the prognosis. So when they come late, their prognosis is poor. Their cost of the treatment will be so high. So this is why we are advocating early screening and early detection, meaning early diagnosis.
When we say early, how early for a woman who maybe she's fine, but she just wants to get this one thing out of the picture for her? For a woman in her younger days, maybe early 20s, 30s, 40s, how early is early, doctor?
When we're talking about early, we're talking about 18 years old and above itself. They should start getting screened actually.
Right.
All right. Because, again, our focus here is breast cancer. Breast cancer is the most common cancer in Malaysia. It's number one among ladies. Very, very common. And a lot of them are not getting diagnosed early because of that. Because they're not getting detected early. So 18 years old and above, actually by right, as a medical practitioner, as a public health advocate, I would advise you to start doing your clinical breast examination. For those who do not know what a clinical breast examination is, it's basically a healthcare professional, can be a doctor, can be a nurse. They will use their hands to just check your breast. So they will check your breast for you to feel for any lumps or bumps. Right. You may not be symptomatic at all, meaning I don't have loss of weight, doctor. Yeah. I feel comfortable. I'm doing my daily activity. I feel fine. But when we check your breast, suddenly we feel something. A BG, we call it. The BG kat sini. So now, next step would be they would definitely refer you to go get a scan done. Of course, for those 40 years old and above, already listed by the government, they must do mammogram. 40 years old and above, every 2 years. This is KKM's guideline.
Women in their 40s, that's when the breast cancer starts hitting a bit harder, right? That's when.
According to studies, it's more common among 40 years old and above. That's when the prevalence is more. Right. But that's not really the case too much anymore. Nowadays, even younger people are getting breast cancer. So mammogram, if you're saying, okay, only 40 years old and above can do, means how about the younger age? Right. So that's when they do an ultrasound breast. Yeah, that also can be routinely done, up to you. But all that costs money, of course. Yeah. So for those from underserved community, at least do a clinical breast examination done yearly. CBE, Yes, where it's a very simple procedure. We just use our own hands. You don't need machine, nothing. And at least we can detect early. So that is the way we are trying to advocate.
They can get it done in any one of the government clinics?
Yes.
Klinik Kesihatan?
Klinik Kesihatan, LPPKN. We have a LPPKN. Their focus is memang for women's health and women's cancer. Right. So they can go there as well. Even at National Cancer Society, they can just come to us to get a CBE done. Any clinic, even a normal general practitioner will be able to do for you. Yeah.
Speaking about breast examinations, there's this one very common fallacy. I think many years ago, maybe now, medical technology would have, advanced in leaps and bounds, that a mammogram would be hurtful. It might be a little bit painful.
Okay, yes.
And that's why many women feared it, because they would get maybe some kind of a metal rod pierced through their breast, or something like that. I don't know. So maybe you can shed some light on that.
Okay, actually, a lot of them don't like the discomfort of getting your breast pressed. Because the whole process of it is the machine will press your breast.
They apply pressure on your breast.
So, a lot of people don't like that discomfort and they find it very painful. But what I feel like when I talk to my patients, when they tell me that this is the reason they don't want to get screened, when you touch wood get diagnosed with breast cancer later on, and you're telling me that pain is not as pain as this pain, isn't that pain even more?
You rather just bear with this one small pain rather than going.
We're talking about mammogram 2 years once. If your mammogram is normal, we're talking, this is KKM's guideline. Okay. 2 years once when your mammogram, for that 1 minute or 2 minutes or 5 minutes under that machine, pain for lifelong protection against breast cancer.
So a mammogram session takes only 5 minutes.
Around 5 minutes.
Around
5 minutes to do per breast So by the time the whole process is maybe about 20 minutes
Doctor, could you briefly walk us through the different types of screenings that are available for to check if a woman is having breast cancer?
Okay, first thing first is clinical breast examination. Okay. That one they can do yearly, they can do anytime actually. In fact, you want to do monthly also can, no problem. I think before that actually there's also something called self-breast examination. Meaning you check your own breast yourself at home.
I am sorry to interrupt you, but that is something that I was reading where a lot of doctors who specialize in the field, in the topic that we're talking about, discourage women from performing a self-examination.
I see.
Because they are not qualified to diagnose themselves. So what could you tell about yourself simply by just examining your breasts? Because you're not a doctor.
Of course. Yeah. That's true. But by them doing it themselves at home, they are able, if they are able to feel a lump, for example, they get to come to the doctors earlier. Before, say, for example, they have made an appointment yearly. All right. November, they see a doctor.
Okay.
All right. Now they've already checked their breast. The doctor said, okay, you're clear. Your clinical breast examination was clear. You can go home.
Right.
December, they themselves feel a lump. But,
Right.
oh, my doctor said, don't come first, lah. You're not sure what you're doing. It's okay. My appointment is next year, November anyway. I'll wait for that. By the time from December to next year, November, if it has grown and the patient doesn't do anything about it, whose responsibility is it now?
Right.
I would rather you check yourself. It's okay.
Yeah.
You may not be sure. It's okay. Come and see us. We will confirm it for
Okay,
you.
okay.
If it's not a lump, we will reconcile you. Okay, this is not a lump. Don't worry. It's nothing dangerous. Come back when you really feel like you have something.
Okay. So yeah, moving on. Self-examination, and then what else?
Okay.
Yeah.
So we have breast examination. We have our clinical breast examination. Of course, we have our mammogram. That's for 40 years old and above.
Okay.
And we have breast ultrasound.
Okay.
So ultrasound is more sensitive than mammogram actually, but ultrasound is for those who, if anything abnormal in the mammogram, usually will be confirmed with a breast ultrasound, because a breast ultrasound can only be done by a professional, so a radiologist.
Radiologist, yes. Okay.
So yeah, for those
And that's where they
younger-
find those lymph nodes and
yeah,
those-
because they will
yeah.
scan not only your breast, we
Yeah.
will also scan your axilla, which is your armpits.
armpits.
Yes, right.
Okay.
To look for nodes, if you have enlarged nodes, all those are signs of poorer prognosis actually.
Right.
So if it's negative, it would be even better. Yeah.
Okay. Dr. Olivia, thank you very much. We're unpacking a lot in this first set of today's W Talk. We'll go in for a quick break.
Sure.
When we come back, we'll dive deeper into today's topic. Today's topic is Strong Woman, Stronger Health, free breast cancer screening by Dr. Lividashni Ganesan. She's from the National Cancer Society of Malaysia. This is W Talk with Anil on the mic. Don't go anywhere. Aloha. Good morning. Welcome back to W Talk on Trax Midday Buzz on this terrific Tuesday. My name is Anil on the mic, and with me in the studio today is Dr. Livia Dashani Ganasan. She's a health promotion lead medical officer from the National Cancer Society of Malaysia. And Dr. Livia today is speaking to us about the free breast cancer screening initiative that is spearheaded by the NCSM. Dr. Livia, welcome back to W Talk.
Thank you so much, Anil.
You're welcome. So, previously, we spoke about the different types of screening, which category of women are much more susceptible towards breast cancer, how early we should perform, a woman should perform a screening on themselves. 18, as early as 18 you mentioned. So just to recap. Now let's get into the crux of the conversation today, the topic today, which is free breast cancer screening, Doctor. So walk us through and tell us who is eligible to receive the free mammogram screening.
All right. So for currently under the National Cancer Society of Malaysia, we are offering 5,000 free mammograms to underserved population. Because our target is obviously those who cannot afford it, who will be able to benefit from this. Okay. So Etika is kindly helping us with this program, where we are giving this free 5,000 mammogram. So underserved meaning those who are from the golongan that cannot afford. We have our own team that will assess that as well to see whether you are really qualified to be underserved community, and you can come to our facility at the National Cancer Society of Malaysia. We are located at Jalan Raja Muda Abdul Aziz to come and get your free mammogram. Ideally, we would ask you to make an appointment with us, but for those not in KL, okay, we have our own partner hospitals as well who work with us, who once you receive an appointment message from us, we can redirect you to our panel hospitals who can help us to give you the free mammogram across Malaysia.
So again, how can they register?
Okay, so you can WhatsApp our clinic number at 010-236-7351. 010-236-7351. You can WhatsApp, that's our clinic number. You can just WhatsApp them. Or if you want comfortable with calling, it's 03-2698-7351. So you can, repeat that number, 03-2698-7351. So you can call our number, you can WhatsApp our number, and just inform that you want the free mammogram. From there, we will assess your eligibility, and then we will get you to get the mammogram. Yep.
Now that we know that NCSM is providing these screenings, free screenings, 5,000 over screenings with the help of another entity. Now, to what extent can early screening improve survival chances, Dr. Livia?
Okay. Actually, for breast, when it comes to breast cancer, about almost 99%. Yeah, according to studies. Because, like I mentioned earlier, when you come early, your prognosis is better. Right. So when your prognosis is better, your treatment will be lesser. I think there's another thing that a lot of people don't know is, do you know that you can even diagnose breast cancer but not go through chemo, radiotherapy, or any kind of...
Yeah, that was my next question. It's maybe because not all interventions need to be surgical or, where you perform a procedure. Correct. You can go through.
Basically, they don't have to go through, because chemo, radio is more of a... They have to go through those dye and whatever too. It's a radioactive procedure. That's what causes all this hair loss.
Hair loss.
But if you are detected very, very early, surgery alone is enough.
I see.
Meaning, we only remove the lump. So now we feel something, we do your biopsy, all right, after screening. Right. After screening, to diagnose cancer is only biopsy. Okay. Where we take a sample of that, whatever lump that we felt, put it under a microscope and look at exactly what kind of cell we are looking at. Okay. So once you are diagnosed, say for example, yes, you have invasive breast carcinoma, meaning breast cancer, and from there we stage you. So once you are staged, that all the oncologist does lah. All right, you'll be referred to the hospital, and then they will do their due diligence, and you'll be diagnosed and staged. If you're staged early enough, surgery alone is enough, meaning they'll remove only the lump, and that's it. And then you are called a survivor. You don't go through chemo, you don't go through radio, and of course, due diligence, you still have to do your mammogram and ultrasound just to make sure that there's no recurrence.
No recurrence.
Yes. So that's how early, if you're that's why we are always advocating early detection. Yeah. Can you imagine what's the cost of surgery and the cost of chemotherapy and your radiotherapy? That's how much money you can save. Yeah.
And also save your life as well.
Yes, exactly.
Speaking about saving lives, I've read many stories, I've heard of many stories of women who knew that they had some form of cancer, breast cancer, one of them maybe, but they kept it to them. They never shared it with anyone because they feared that they would be looked upon differently. They didn't know how their immediate family circle would respond to them. And also, for a woman, it's personal image as well, Doctor.
Yes.
It's the way she presents herself. It's her figure as a woman. Those are the things that make her unique, right?
Yeah.
And I think apart from treatment and early screening, I think a support group, creating that safe space for these kinds of women, for them to come out of it, for them to, be spoken to and coerced into feeling that, look, it's absolutely fine. You don't have to suffer in silence. On that respect, what is being done at NCSM? I'm sure there is something.
Yes, definitely. We have a lot of support groups.
Yeah.
Mainly our primary support group in National Cancer Society is the Pink Unity.
Right.
So they are very, very active in especially the Klang Valley and KL area. They are a group of all breast cancer survivors or ongoing breast cancer right now, going through treatment and such. And they, when they come together, they really help give advice how they cope. Because not every individual go through the same thing. Everyone has their own journey. Everyone has their own way of dealing with it. So sometimes when you want to ask for help, you don't know who to ask. So that's where the support groups come in very important lah.
Okay.
Yeah. So you can meet a lot of people giving a lot of advice, and you can use those advice based on your experiences.
Yeah.
So you can see which is more suitable for you. Yeah. About the stigma, unfortunately, it is something that I think has to change in the community level. The mindset needs to change. I do know a lot of ladies from especially the underserved communities who really look at breast cancer as a taboo. And they do not want to get screened because of that. I don't want my breast to change. My husband won't like it.
Correct. Yeah.
And that is very sad because it's at the end of the day, we're talking about your life. So I feel like ladies should, when it comes to their health, priority should come to their health over stigma.
Correct.
Yes, they need to be able to talk to someone. They can always come to National Cancer Society. We have a lot of our people that can, support them, give them guidance, to give them support. And they can call our toll-free number and call us, and we can, book an appointment for you to meet our support team. We have psychosocial support. We have what we call this dietitians as well. We have the Pink Unity group as well. You can come, talk to us, and we can give some advice. And
Dr. Livia, you said something that I'm sure would have echoed in the minds of a lot of our women listeners who are listening right now.
Yep.
I don't want to do anything to my breasts because I fear that my husband will not like me. Fantastic juncture in our conversation, which we could use this to speak to our male listeners who are listening out there. What's your message to the men, on how they should be dealing with their wives who are maybe going through breast cancer, maybe on the cusp of losing their breast? Maybe it's come to the point where nothing can be done to salvage and they have to remove it. How do we comfort these women?
Their social support is so important.
Yeah.
Family support, social support. So husbands play a huge role in this, definitely. I think to the husband listeners out there, if you can, be very, very supportive. I understand it's not an easy diagnosis.
Yeah.
You are also going through a turmoil of emotions with your wife's diagnosis as well. This is not only affecting the ladies, it's affecting their families as well.
Yeah.
So if you need someone to talk to, even at NCSM, we can talk to you. We have our support team that they also talk to family members to teach them, other family members who are also going through the same thing, who can have counseling sessions to talk about how they coped with their family members' cancer diagnosis.
Correct.
So, in that sense, they can always talk to us as well. Find the right people. Find the right people to talk to. Not everyone's story is your story. You have to find someone who relates to your story so that when you are trying to move forward from your family member or your own cancer diagnosis, it is very relatable to you.
Right. Great. And when she survives, like you said, she becomes a survivor. She breaks out of this cocoon and she becomes Wonder Woman, and she proves it to the other women. Look, I did it. You can do it too.
Yes, definitely.
Right?
Yeah.
And if your husband ever says something wrong, ask him to come and see me or come and see Dr. Livia.
Yeah. I will can give peace of my mind.
Okay, by the way, we're streaming live on TikTok as well. If you head over to our TikTok profile TRAXXfm's TikTok profile, which is TRAXXfm. We're streaming live on Facebook as well. Yeah, producer Juliana, we're streaming live on Facebook. And you have some questions that you wish to ask Dr. Livia, feel free to drop it in the comment section. We'll try to address them while we go in for another quick break. This is W Talk. Aloha, welcome back to Trax Midday Bus. It is W Talk with Anil on the mic and my producer Juliana, and together the two of us are having a conversation, a very revealing, intriguing one to discover more about breast cancer and also free breast cancer screening that's offered by the National Cancer Society of Malaysia. And talking to us today about that is Dr. Livia Darshini Ganasan. Of course, your brother must be a very proud man of your success so far and the great things you're doing for public health, Dr. Livia. Welcome back.
Thank you. Thank you so much, Anil.
Okay, turning our attention now to what we have on TikTok over here. Some testimonials, first of all, from the National Cancer Society. Someone actually says that, wow, it's really great. It's good. Who is this? Cole says that the NCSM has saved my wife's second breast under armpit, and it's good to go and get some assessment. The staff there are very friendly, so it's great. And we got a question. Where's that question? Let me scroll and pick on it. There we go. Okay, Fadil Abdul Ghani says, or rather asks, what are the other possibilities of lumps on breasts other than cancer?
Okay, it's a very good question actually.
All right.
There are a lot of reasons why there could be a lump in your breast, not necessarily cancer. So a lot of them, I think that's the stigma. When you cough lump, you're scared it's cancer. So we have something called cyst. Basically, it's just a biji with water inside. That's a layman of description of what a cyst is. That's not dangerous. We have fibroadenoma. We got a lot of other benign diagnoses, meaning those are lumps, but they are not cancer. But they can develop into cancer if not monitored. This is why when you do early screening, if say for example you have a cyst, you have a fibroadenoma, you still need regular follow-up. You still need to scan regularly to just make sure that those normal benign stuff do not turn malignant, do not turn into cancer.
Right.
Especially when it comes to cyst. Cyst is something very hormonal. It comes and goes. So sometimes today you scan, there's a cyst.
Yeah.
Next week you scan, the cyst will be gone.
Missing.
Yes. So it's a very, nothing dangerous about it, but you still need to monitor it because we don't want it to grow. We don't want it to become something else.
Is it hereditary, breast cancer?
Hereditary, definitely.
What percent of it is hereditary? And the other, maybe, what would you attribute to, or for someone?
Breast cancer being one of the most common cancer in Malaysia, it is very, very hereditary lah. I wouldn't say very, very, but in terms of how do I say, if you have a family history of cancer, any type of cancer, doesn't necessarily mean okay, my mom had breast cancer, I will definitely get breast cancer. No, but you can also develop any other cancer. It's very labile. Very hard to pinpoint and say, okay, your father had prostate, you're going to have prostate. Your father had breast,
so
mother had blah, blah, blah.
It could come up in any part of the body,
yes,
in any form.
Correct. As long as you have the cancer gene.
Yes. There's a cancer marker, they call it.
Cancer gene. Cancer gene comes under your DNA level.
I see.
Marker is more of a blood thing. But that's why it's important we just advocating screening. Like just now when we were speaking about how men and I know family members, underserved community, they're worried about the stigma and all, and losing their breasts and such. So when it comes to that, that's why we are advocating early screening. If you don't want to get there, you don't want to be at that level where you have to lose your breast, do it early, catch it early, so that we can help you early. Then we catch you, help yourself, help yourself get detected early. We can help you have a meaningful life without losing your breast or losing,
Let me catch you on the men there. Let's do some justice to the men who are listening as well.
Yeah.
How susceptible are men from being diagnosed with breast cancer, doctor?
Breast cancer in Malaysia for men is actually 1%.
That's a lot.
Yes. So there is actually men who are diagnosed with breast cancer. I have not personally seen any.
Okay.
But I have met a lot of patients who, when when they come for their screening, our routine question is, anyone in your family got cancer or not? And there are people who come and tell me, my father had breast cancer, my uncle had breast cancer. And that just shows to me that their I'm talking about their gene level, family history of cancer is so much higher. Because if it can affect until men, that's how much more stronger it is, the risk for you.
Yeah.
So this is why I would advocate, okay, then you have to do it regularly. We want to make sure that we catch it early if you do develop to get breast cancer. So even in men, I understand a lot of them have asked me also actually, doctor, I don't have breast cancer obviously, but how do I check?
Yeah.
Okay. So for men, because they don't have breasts as such, we cannot do mammogram for them. But because they can just do an ultrasound chest. Yeah. So if you want to just screen, you can do an ultrasound chest, or because they are, I guess, flat. It'd be very obvious if you develop cancer.
So if
the lump will be so obvious.
So for instance, for a man who's a bit slightly overweight, maybe like me, and I have gynecomastia, so maybe then it might be a bit more easy.
It's a bit difficult actually.
Really?
Because for those who are more leaner, they are flatter. So we are, you can see. Yes, even without trying, they put their hand also, they'll be able
you
to
can
feel
feel
something.
the lumps.
Correct, yes. But for more obese men, it's harder because it's full of fat. So it'll be embedded in their fat. So how we can help yourself is by doing an ultrasound chest.
Right.
Because we can't do ultrasound breast for men, so we do an ultrasound chest just to check.
Okay. Dr. Livia, thank you very much for setting aside your time, coming over here from the National Cancer Society. Some very bright minds there, lending their expertise towards the betterment of public health. And Dr. Livia is an example of that. We really appreciate your time. And also all of the other previous guests who have appeared here on behalf of NCSM. Now, so before we let you go, it's W Talk. It wouldn't be a W Talk if I didn't do this with you. We've come to the seed planting moment. Yeah, it's where we plant seeds of inspiration. I'm sure a lot of girls out there who are aspiring to become a medical doctor just like you would have been, swept off their feet like, wow, I want to speak and I want to do the great things that Dr. Livia is doing. So let's inspire them. That's the camera over there.
Okay.
Look into the camera and speak to them and plant some seeds of which one fine day a girl will come up to you and say, Dr. Livia, I heard your conversation with Anil on the mic. Very cool dude. But apart from the dude, you inspired me. Go ahead.
I think for all ladies out there, for young girls out there, it's so important for us to take care of ourselves. At the end of the day, our priority should be us. So do your due diligence. Do what you need to do for yourself, for your health, especially, when it comes to women's health. We're talking about breast cancer, cervical cancer, any kind of woman's cancer. Very common and very stigmatized. That's why it's so common. So this is where we have to come together to help each other and put ourselves first. So I hope that helped.
All right. So there you have it. Final parting words of wisdom from our guest, Dr. Livia Darshini Ganesan, Health Promotion Lead and Medical Officer from the National Cancer Society of Malaysia. And today, Dr. Livia spoke to us on how you can be a strong woman and have a stronger health and understanding better about cancer screening. Thank you, Dr. Livia. Have a lovely day.
Thank you.
All right, so that is a wrap. And if I may just add on, remember, cancer screening is not a stigma anymore. You should never be in a dilemma. There is help out there. And more importantly, there is a very strong support system to help walk you through the entire process until you become a survivor. The numbers that has been provided, there's a WhatsApp number for NCSM. That's +6010 236 7351, or otherwise you can even give them a call at 0326987351. Get some help, get yourself cured, and I will tell you, you will feel like a superstar. By the way, Dr. Livia, you told me earlier that there is a song that you listen to before you step into the examination hall to become to sit for your MBBS, your med school exam. Tell us about the song.
It's actually the fight song by Rachel Platten, because that gave me some courage to keep going, to keep fighting, to make sure I move forward in life.
So let's put some fight in all our women and girls out there.
Definitely.